So I looked into a study that investigated the effects of vitamin K supplementation on the progression of coronary artery calcium in older men and women. So briefly, the study involved 388 subjects, and the subjects were asymptomatic ambulatory community dwelling subjects who were aged from 60 to 80 years old. 60% of the subjects were female, and the average age was 68. This study was double-blind RCT or randomized controlled trial, and the intervention was vitamin K supplementation of 500 micrograms. The follow-up period was 3 years. So this study found that in the subjects who were more than 85% adherent to the supplementation, they had decreased CAC progression. Now we take a closer look at the study. The study recruited 599 subjects at first, but then they excluded 125 subjects because they did not meet the inclusion criteria. And the rest of them were randomized into two different groups. The intervention group received vitamin K, multivitamin, calcium, and vitamin D. The control group received no vitamin K, but the other supplementation. And then during the process, there was loss of follow-up due to various reasons, and the rest of them completed 3 years of intervention. Their CAC level was measured at baseline and after 3 years of intervention. And then further analysis was done on those subjects who were at least 85% adherent to the intervention. So here's the results of the study. So we can see that there is actually no significant difference between the two groups in a Gaston score. The Gaston score is predictive of the coronary calcium calcification in the vascular. So if you have an Gaston score of 0, it means that there is no calcium seen in your artery. So the lower the Gaston score, the better. So because the p-value is higher than 0.05, so there's no significant difference, but there is significant difference between the MGP level between the two groups. So MGP is matrix GLA protein, and it is a potent inhibitor of vascular calcification, and it requires carboxylation by the vitamin K to exert the calcification inhibition. So you can see that the MGP level is higher in the intervention group. So it means that it did improve or it did decrease the CAC progression in these subjects.